do we manage common cold and flu? We manage common cold and flu, first of all, by supportive measures. For example, uh, increasing on fluid intake, mainly warm fluids. Number two, if the child is still breastfeeding, we encourage the mother to breastfeed the child more, and then keep the child warm always, all times. And then we can have medical management, but before we go to medical management, an important point to note is we don't treat the viruses that cause the cold and flu. Rather, we treat the signs and symptoms the patient presents with. And the medications we commonly use, one is the nasal decongestants. Nasal decongestants, an example is oxymetazoline. It is a nasal drop. We put 2 drops in each nostrils 3 times a day. Another example is saline nasal drops. We also put 2 drops 3 times a day. And another example is pseudoephedrine. We also put 4, 3 times a day. Some patients require antihistamines, others do not require. If you're only having nasal congestion, you only need nasal decongestants. Though some patients require to use antihistamine, and the examples of antihistamines include cetirizine, which is most common, and then there are others like avastin, ranitidine, desoratidine, and many more that a patient can use to alleviate signs and symptoms. If a patient is having fevers and body aches, you need to give an antipyretic, an example of Panadol or paracetamol, and other antipyretics that you can give. So, alleviating signs and symptoms of and the discomfort caused by the common cold and flu, we encourage our patients to take warm water, plenty of warm water. We also encourage our patients to have home remedies like honey ginger at home, and also we manage using nasal decongestants. So when should you seek for healthy care? You seek for healthy care uh, when you're having nasal congestion, you're having excessive sneezing, you're having a running nose, which is associated with sore throat, headaches, body aches, and in children, if your child is not breastfeeding normally, is irritable, is lethargic, and is having decreased appetite. We prevent common colds and flus by hand washing, wearing a face mask, and then getting an influenza vaccine, which is got once every year. Thank you.